morning, everyone. Thanks again to Vicky for a great introduction. As she mentioned, digital preservation of reproductive health resources, or short name Archiving the Eighth or Archiving Reproductive Health, is a project funded by Wellcome and is carried out by the Digital Repository of Ireland to preserve and publish digital materials relating to campaigns for reproductive justice and reproductive health in Ireland, especially during the campaign to repeal the Eighth Amendment in 2018, which Vicky mentioned. The aim of this project is to provide long-term preservation and access to at-risk digital archives generated by grassroots women's reproductive health movements. Just a short bit of context for people outside Ireland. Many countries around the world have seen mobilizations of people for progressive change in recent years. Ireland is no exception. In 2018, the Irish public voted in a referendum to repeal the Eighth Amendment, which meant that the Irish government was able to pass legislation enabling elective abortion in Ireland for the first time in the nation's history. So there's much more information out there about the history of the Eighth Amendment. I won't go into it all here, but it was in place from 1983 until 2018, and it limited the ability of medics and legislators to legislate and carry out abortion care in Ireland. This project works with key stakeholders, including the Abortion Rights Campaign, which is a voluntary organisation, Together for Yes, which Vicky mentioned, Terminations for Medical Reasons, the Coalition to Repeal the Eighth, and many others. I'll be talking about those organisations in a bit more detail later in the presentation. So up to date, this project, Archiving Reproductive Health, has gathered and preserved a selection of digital objects and research data, including some social media data that tells part of the story of this historic campaign. The preservation and publication of these collections add significantly to our understanding of women's rights movements and access to reproductive health care in Ireland. Not only does the project allow for the preservation of fragile digital content, but it also makes way for further research developments in this field. I'll just quickly summarize the organizations that we've been working with, and then I'll speak about them a little bit more detail later on. So I've already mentioned the Abortion Rights Campaign, Terminations for Medical Reasons, Together for Yes, the Coalition to Repeal the Eighth. We've also worked with In Her Shoes, which was a Facebook page which shared women's stories of accessing abortion in Ireland before the Eighth was repealed. In Ireland and abroad. We also have research data from Real Productive Justice, Gender and Disability Project, Physician Advocacy and Reproductive Rights in Ireland, Posters in City Streets, The Linguistic Landscape of the Eighth Amendment, and Retweet the Eight Twitter dataset from the referendum. I'll say a bit more about these organizations when we do a kind of a live tour of the collections. This is the Archiving Reproductive Health team. Our principal investigators across the three institutions that work in the Digital Repository of Ireland are Aileen O'Carroll in Maynooth, Catherine Cassidy in Trinity College Dublin, Natalie Harrower in the Royal Irish Academy. The project team is myself, Lorraine Grimes, who's a postdoctoral researcher and digital archivist, and Pritam Singhvi, who's a junior software developer. And we also had expert advisors from the DRI team. Lisa Griffith was the membership manager and Kevin Long, our digital archivist. So I just want to give a little overview of how the project has been going to date. It started in the beginning of 2021. I came on board in around July 2021. And on March the 8th, 2022, just a couple of months ago, we published a series of pilot collections showcasing work from our stakeholder organizations and some research data sets as well. So the collections include photographs, videos, and design assets from 3 of the Marches for Choice, which were annual marches, still are organized by the Abortion Rights Campaign. We also have design assets and press materials from Together for Yes, the Coalition to Repeal the Eighth, and Terminations for Medical Reasons. We also have a selection of stories from that Facebook page I mentioned, In Her Shoes, and we'll be publishing more to follow. So that's just a quick summary of the pilot collections and the organizations. You can see that an example of some of the material there is a banner for the 2016 March for Choice, a little infographic that the Coalition to Repeal the Eighth put together to solicit donations. We have the I voted graphic from Together for Yes. That was a sticker that was shared on the day of the referendum, and Terminations for Medical Reasons, that drawn heart logo was one that they used early in the campaign. And then on the right-hand side of the slide, you'll see a couple of pictures from Marches for Choice from, I think they're both from 2017 for different groups. There's a quick look there at some of the research data collections that we have also preserved. So the bulk of the research data is oral history interviews with medics, campaigners, and women's rights activists in Ireland. So they're provided by projects such as Reproductive Justice, Gender and Disabilities, and the Irish Qualitative Data Archive, and a number of individual researchers. So on the left-hand side of this slide, you see an excerpt from an interview with a doctor named Marion Dyer, who was part of a group named Doctors for Choice, which advocated for changing Ireland's abortion laws from kind of the 1990s onwards. And the oral history was her speaking about her career as a doctor and her activism in the same field. And then on the right, there's a photograph from the collection that was produced by the researcher Louis Strange, which was photographs of posters that were put up in Dublin and around the country in the run-up to the referendum. So you can see there's a selection of posters from Together for Yes, and from a couple of the No campaigns, and from a couple of political parties as well, both advocating for a yes vote. We've also published research protocols. A big part of this campaign is this project is trying to make our processes open source and accessible to other researchers and scholars as well, and to digital archives. So these two, the two we've published so far are an ethics protocol and a researcher self-care protocol. The ethics protocol has been developed to ensure the quality and integrity of our research and archiving processes, and has outlines the ethical issues which arise from the project, and to ensure transparency in the project. And I'll go into some of those issues a bit later in the presentation. The self-care protocol includes practicalities for working with sensitive or traumatic data, which is the In Her Shoes collection contained a lot of material like this. So this protocol was developed to help archivists and researchers working with this kind of material. It focuses on the potential to harm to the researcher when working with sensitive data on reproductive health, and contains a number of recommendations. Oops, sorry. We've also put together a bibliography, which is basically a bibliography of sources in the area of research ethics, work, and outlines working with sensitive and potentially traumatic research. So the bibliography focuses on strategies for researchers to work effectively with this kind of data. So it's quite specific in that regard, but we have wider research bibliographies as well. But this is the one that we have shared publicly so far, but we'll be sharing more. We've also done vocabulary research. So one of the outcomes, or the deliverables for this project, is recommendations for uses of thesaurian vocabulary for archiving collections related to reproductive health and reproductive justice. So some of it has involved modifying existing vocabularies or coming up with terms ourselves, and the final output will probably be some combination of both. But one example of how we did this was the various stories from In Her Shoes, the Facebook page that Lorraine Grimes catalogued. She also reviewed and coded them using sociological data analysis methods, and produced a code book of the most commonly used terms in the stories. There were several kind of repeating terms that were often used. And then I worked on augmenting this code book by mapping the terms identified by Lorraine, matching them to terms used in the Hassett thesaurus, which is the Humanities and Social Science electronic thesaurus, the leading British English thesaurus for the social sciences, and it's produced by the UK Data Archive. So this is just some of the work that we've been doing on augmenting and developing vocabularies, and I'll be talking a bit more about that in the live run-through session. So I'm going to just do a quick walkthrough of the pilot collections. So what I'm going to do is I'm going to stop sharing and then reshare with the window, which includes the actual repository. So if you just bear with me a moment, I will do that. Okay, can everybody see the Digital Repository of Ireland homepage? All sound good?
Yes.
Great. Okay. So in the repository, if you navigate to organizations, browse by organization, you can see Archiving Reproductive Health. So I'll just scroll down and here it is. And here you can see all the pilot collections that we have preserved so far. So you can see where I'm highlighting there. So I'll just call up the various collections and then I'll go into them. So you can see them all there laid out. And the first one I'm going to go to is this Abortion Rights Campaign collection. I'm just going to click on that there. So so as I said, this is the Abortion Rights Campaign collection. So the Abortion Rights Campaign, or ARC, is an all-Ireland campaign for free, safe and legal abortion in Ireland. It was founded in 2013. ARC was one of the 3 organisations that made up Together for Yes, the national campaign to repeal the 8th Amendment. ARC has organised a March for Choice, as I mentioned, every year since 2013 and continues to advocate for better access to abortion care in Ireland and in Northern Ireland. You'll see here a list of subject terms. Most people here would be familiar with subject terms, but I'll just run through them quickly. They're used here for cataloguing purposes. As most of you will know, they come from established vocabularies that are used in the archiving and library sectors. So most of these terms come from the Library of Congress subject terms vocabulary. Again, I'm sure lots of you are familiar with it. It's one of the most commonly used vocabularies in English. This is an example of us creating subject terms ourselves. So this one here that I'm highlighting, Constitutional Law Ireland, the 8th Amendment, was one that our digital archivist Kevin Long created using the Library of Congress structure. So if I were to click on that now, I would see all the various objects that we've preserved in the repository using that subject term, and they're all objects from this particular set of collections. So that's one example of us kind of developing subject terms as we go. There's a couple of terms in capital letters. They come from HACCIT, the source I mentioned just now. That's the way they display on repositories. And there's also OSLC FAST, which is another kind of Library of Congress style vocabulary. And then there's others like Loganum, which is an Irish place names vocabulary, which can be used for identifying particular townlands and particular places in Ireland. Other terms used include geographical place, like Ireland, as you can see, subject place, subject temporal, 21st century, and languages. Under languages, you can see of English, Irish, and Irish Sign Language. We also have underneath rights and licenses. So it says rights, copyright, abortion rights campaign, and individual rights holders license for reuse under a Creative Commons attribution share alike license, unless otherwise stated. We're going into this in a bit more detail when I'm talking about fair data, but basically the deposit agreements that we've signed with the organizations have agreed to make the material available on an open license unless there's some other form of restriction on it. But for the most part, we haven't had any problems with that. So the easiest way to navigate a collection is to go to all, see objects in this collection, and then click all, and then you could filter using facets. So for example, I can just click all there and it'll gradually bring me over to show me all the objects in a collection. I can filter it so that it shows me a certain number of results. I can put it up to 48 there if I want. And then at the facet, you see this bar called Refine Your Search. This is the facet search bar. And under that, you can see there's various different categories. In this one, I can pop out media type and say, for example, just select video. And then it shows you all the videos we have. Also, there is the option of filtering to sub-collections. So if I just quickly switch back to sub-collections. Oh yeah, I'll just take that off. I just take, it gives you 2 sub-collections there, or sorry, it gives me 1 sub-collection, which is just the Marches for Choice, which contains material to do with Marches for Choice, which is the bulk of the material we have at the moment. So I'm just going to go back to, Abortion Rights Campaign collection, and then I'm going to go back to select videos. Just 1 second. Unfortunately, it doesn't give you little thumbnails of the videos. We haven't got that functionality yet, although it does do it for photos. I'm just going to briefly show you just a few seconds of this video here, just to get an idea of the type of material we have. So this is a time-lapse video of the 2017 March for Choice. This video was made by an activist who kindly gave us permission for it to be published in this collection under a Creative Commons license. So it's a time-lapse of the whole march, passing a fixed point at the corner of Merrion Square and Clare Street in Dublin. I'm not going to play the whole thing because it's 6 minutes long, which gives you an idea of the scale of the march that year. But I will play you about 20 seconds worth so you can see the scale of it. I would normally full screen, but it doesn't, the full screen on the repository doesn't render very well over Zoom. So I'll just show you this small screen. It doesn't have any sound, so it'll just be a visual. I'll just give you an idea of that now. So that just gives you a nice idea of that video, which is more or less just that for 6 minutes. We also include a number of videos of speeches that were given at the Marches for Choice, which were all videoed by ARC at the time, and preserve them here so that, because we would get there would be a number of speakers from different organizations representing different kind of interest groups. I'm just going to return to browsing by organization and just get back to my Archiving Reproductive Health organizations. There we go. So I want to just show you the terminations for medical reasons collection here. So we were privileged to have terminations for medical reasons as a stakeholder in this project. It's a voluntary group that supports women, parents, and families following diagnosis of a fetal anomaly during pregnancy. It was founded by people who themselves received diagnoses and refused termination of pregnancy services in Ireland and had to either travel abroad or to end their pregnancies, or were forced to continue their pregnancies in Ireland against their wills. They were a very important part of the referendum campaign in 2018, and they still operate and work to this day. The collection is relatively small at the moment, but we're adding more to it as we go along. I'll just give you a quick look at some of the stuff that's in there at the moment. A lot of it is to do with the kind of media assets and media materials. But one thing I just wanted to show you briefly, this is a collection of testimonials. It's a picture. I'll just make it a bit bigger there. Yeah, so if I can see that okay. It's basically a collection of testimonials by people and couples who were affected by this issue, and they were happy to talk about this openly. And this was a very important part of the campaign because there was a lot of aspects of this that people who hadn't been through it weren't aware of. So having these conversations was a particularly important part of the campaign. So I'm just going to quickly hop back again and select the Together for Yes collection. So Together for Yes, as mentioned earlier, was the national campaign for a yes vote to repeal the 8th Amendment. It was made up of representatives from ARC, as I mentioned, from the National Women's Council of Ireland, and from the Coalition to Repeal the 8th, which I'll be talking about in a minute. So at the moment, these collections again are mostly kind of media assets and things, but we are going to be adding more administrative documents later on. So there's a few photographs here. There's some nice photographs from a tour that was done around the country towards the end of the campaign, where people, basically activists, traveled around with lots of banners and things like that and met with activists in local areas and did photo ops. And these were done for like about a month before the referendum, as well as a lot of other things as well. The Coalition is one of the organizations that's less active now. It really existed more in the preliminary period, but, sorry, didn't mean to go into that. It was a broad umbrella organization which was intended to bring together a wide range of civil society organizations that supported the repeal of the 8th Amendment. So it was quite a broad church. It was again one of the 3 organizations that made up Together for Yes. And this again contains a lot of publicity materials. There's one I'll just show you here. There is a poster from the first public meeting that the Coalition held. So you can see here it was in 2014, and it was the first, you can see it's building a coalition. It was the first time the organization had basically tried to bring together lots of different organization and representatives and see if they could build some kind of umbrella organization. And you can see like the logo design obviously changed over time. So that initial logo was changed to the one this one here, this kind of one of the lines, and that became the kind of definitive logo of the campaign later on. Excuse me. I'm just going to talk about real productive justice. Yeah, just give me a second. Yeah, here it is, real productive justice. So real productive justice, gender and disabilities is a disability rights and reproductive justice project based in NUI Galway. So that's the National University of Ireland in Galway. And we've been really privileged to work with the researchers on this project to add these oral history interviews to the collection. They're basically transcripts of interviews with individuals about the barriers and facilitations when accessing reproductive health care or when making reproductive decisions as a person with a disability in Ireland. So again, all the objects are basically text files, PDF files with text in them, with information, basically just outlining the interview. So you can see just a little bit of it there. And there's been anonymization done on them as well. And then pop back again. Just speak about physician advocacy and reproductive rights, Doctors for Choice. So I mentioned Doctors for Choice earlier. So this collection was comprised of oral history interviews conducted by Sadie Bergen, who is an American doctoral candidate in interdisciplinary social science and public health programs. And during the summer and autumn of 2019, Bergen conducted 60 to 90-minute interviews with current and former committee members of Doctors for Choice. And other interviews included part-time Doctors for Choice staff members and key participants from organizations involved in Irish abortion politics between 2002 and 2018. So it gives a good look into the state of play before the 2010s, which was quite a long period. And then I mentioned the linguistic landscape, this one here. So this was a visual collection created by the researcher Louis Strange, containing 432 images of signage from the 2018 referendum. It was collected during the week before the vote itself. So that would have been when the sort of public signage was at its peak, and includes campaigns of campaign posters, graffiti, stickers, banners, and they were taken from a number of locations around Ireland. They were taken by Louis as part of his PhD research into what he called the linguistic landscape of the 2018 referendum campaign. And it looks at the use of language in public spaces in the lead up to significant votes, such as this. So as I said before, you can see the little thumbnail there contains the photo that I showed on the slide earlier, which is again a good kind of cross section of the number of posters and visual material that we saw in Ireland in the run up to the referendum. So I've mentioned In Her Shoes a couple of times, but I haven't fully gone into what it is. Basically, it was a Facebook page which included personal accounts from women in Ireland who sought abortion prior to the repeal of the 8th Amendment. So the stories are written in the woman's own words and were taken from the In Her Shoes Facebook page, which was set up in January 2018. The Facebook page was very important in helping voters understand more about the impact of the 8th, because again, it was ordinary people, ordinary stories, ordinary circumstances. It captured the reality for many women living under the 8th Amendment and offered an insight into the difficulties surrounding the illegality of abortion. The stories provide details of being refused healthcare, barriers to access, traveling for healthcare abroad, ordering safe but illegal pills online, and the emotional impact of that. I'm going to talk a little bit more about the specifics of how we've preserved the stories, but just to give you some preliminary context, I'll show you what they look like. So as you can see, the story is preserved as a text file. So you can see that's the text there. And then in the metadata, we have a link to the story on Facebook, and we also have a link here under sources. I'm going to talk a little bit more about why we did it that way in just a moment. I'll leave Retweet the 8th. It was basically a collection of Twitter IDs, just because I don't want to go over time. But it's basically, if anyone wants to know about it, it's a collection of numbers linking to Twitter IDs, tweet IDs about tweets that use popular hashtags in the run up to the 8th Amendment. It's more of a preservation asset. It doesn't really display the tweets. It just shows you the ID numbers, but it's just useful even from a preservation point of view. So actually, I might be able to switch straight back. Does that switch you back to my slide? Does that show you my slide again, or should I stop and reshare?
That shows the slide, but not in presentation mode.
Oh yeah, I'll put it in. So I've just put it into presentation mode. Can you see it as presentation?
Perfect.
Great, that's good. I thought I'd have to unshare and reshare. So we're working at the moment on putting some additional material in. We are aiming to have a new tranche of material in the repository from this project for the 25th of May, so in a couple of weeks. So these are research data collections that are ready. Lorraine has prepared them for ingest. They are, again, oral history interviews from 3 academics who have worked in the area of women's rights. So you can see there's some from Linda Connolly. She's spoken to women who were active in the women's movement in the 1970s and 80s. And then another researcher, Mary Muldowney, has spoken to people who work specifically in the area of pro-choice activism between 1983 and 2010. And then Camilla Fitzsimon spoke to people who were directly involved in the campaign to repeal the 8th in 2018 and their experiences of that. We are next working on preserving a number of administrative documents. So we'd like to archive things like campaign work plans, meeting agendas, annual reports, and policy briefings. There you can see just to the right-hand side of the slide, there's just a quick summary of some from the coalition, the type of material that we have access to, and that the organization has agreed to have us preserve. So we are hoping to get as many of these in as we're hoping to get a representative sample of this kind of material in by the 25th and then keep adding to it as part of the project. So I'm just going to talk quickly about some of the challenges that we faced in this project, of which there were quite a few in interesting sort of unexpected ways. So preserving the Facebook stories of In Her Shoes had a couple of potential legal issues associated with it. So the copyright is always with the original author, but in many cases, these were anonymous, or actually nearly all of them, these were anonymous posts, and the people running the Facebook page didn't have the information of who had actually shared the stories with them, and they were intended to be anonymous. There was also a question as to whether it could be used, it could be preserved and shared under the GDPR archiving exemption. There's different theories on this. We wouldn't be inclined to think that it is. Sometimes we have heard that any kind of special category personal data, which is relating to healthcare and political leanings and things like that, would remain outside of this exemption, but it's not entirely clarified in the legislation. So we decided that our way to kind of make sure that the data was safeguarded and that the kind of rights of the storyteller were preserved as best we could was that we have some of the stories are public in that they've already appeared in a book produced by In Her Shoes. So we were able to share those, preserve those stories publicly, as you saw on the last slide, or the last one, the run through in the repository. But for those that there isn't explicit permission to share them publicly, the access to them will not be completely open. It will be accessible to researchers engaging in research who simply have to contact the contact DRI and ask if they can have permission to access the stories, and there wouldn't be any issue after that, but it wouldn't be necessarily clickable by any browser on the repository. Obviously, we would publicize our intention to archive this material widely so that anybody who did contribute to In Her Shoes and would like their story to be more public can contact us and give us their explicit permission. Also a notice and action policy, which we have developed, which ensures that we will remove a material on request from the data subject. We assume good faith on behalf of the applicant. The majority of the stories were anonymous anyway, but any identifiable data that remains has been removed. And of course, the metadata for all our collections in DRI is always open and accessible, even if the actual object itself is restricted. So in each object, we also provide a quote from the story and an open and unrestricted link to the Facebook page. So that's what I was pointing out earlier, that somebody who comes across an asset in DRI, which is this story, and it's restricted to researchers, we have also provided a link to the Facebook page, which has it up publicly, and the person, if they wish to, could navigate to Facebook and see the story that way. So it's not that we're precluded by kind of any law from sharing these stories and preserving them on our preserving and making them available to any user. It's just to abide by the tenets of our ethics protocol. We want to try and protect the data rights of the person who contributed the story as much as possible, and make it and kind of go by that basis from the beginning as much as we can. There were some challenges around exporting the Facebook data. So Pritam Singhvi, that I mentioned earlier, he spent a lot of time with Catherine Cassidy, our PI, researching methods for the open sharing of social media content, which is often quite tricky to navigate due to proprietary platforms. So we've worked primarily with Facebook so far, and Pritam has used its API to export the stories from In Her Shoes, working directly with the, oh God, sorry, I just skipped something there, just give me a second. 1 second. Oh yeah, here it is. So using the API. So anyway, as I was saying, these stories are preserved on the repository as text files with the link provided to the original story on the In Her Shoes Facebook page. This ensures that the content is preserved. But browsers have the option of linking to the Facebook post if they wish. So Pritam analysed Facebook/Meta's current compliance policies, and we discussed as a group the best way to preserve the material in a way that is compliant with platform policy and enables fair data preservation. So what I just described before was the kind of the solution we came up with. There was a few additional technical challenges. The original data export, which was put through before Pritam started, actually had some missing data. So Pritam re-downloaded it to fill the gaps. There were some shortcomings with pre-existing Facebook tools that are used to download page material. So Pritam worked a bit around those to make sure that all the relevant data was captured. So you're not precluded from using the API to collect your own pages, a page that you have access to data. It's not entirely clear if you can archive a Facebook page as a Facebook page and display it on another platform. So using just the text file with the link to the Facebook story was kind of a workaround there. The other challenges in archiving administrative documents is trying to find out whether it's legally or ethically okay to include names of attendees of meetings if we're preserving meeting agendas or minutes. It has been done in other collections that exist, so that it's not something that's necessarily always precluded. So we're not precluded from archiving meeting minutes. We just need to confirm consent with any named people or just anonymize them to adhere to our ethics protocol. In some cases, an organization has given explicit permission to publish meeting agendas with the names of attendees, and because that was already got from the attendees when they first attended the meeting, that it would be a public document. So in that case we can, but we're not defaulting to it unless we have explicit permission. I'm also in the process of inquiring with some other collections to see what their protocols are with regard to retaining individuals' names in meeting minutes from relatively recent history. So during this collection, we've worked quite closely with a lot of organizations, ones that have worked with us, and it has had a huge amount of benefit to have that kind of direct relationship and to be able to work directly with the organizations. And one way we kind of manifested that was by setting up a stakeholder advisory forum. So this consists of representatives of each of the organizations whose data is collected as part of this project. And the aim, and also from experts in the fields of research data, ethics around research data, and ethics in archiving in general, and also in the area of medical research. So the aim of the forum is for us to get feedback from stakeholders about the project and the collections. We want to ensure that we're collecting and archiving the material in the best way possible. And we feel that the people involved with the organizations are either as volunteers, as researchers, are best placed to give us this feedback. So we held the first stakeholder advisory forum meeting on the 14th of April, so just a couple of weeks ago. And we got feedback on the use of some metadata terms, what collections to prioritize for the next tranche, and discussed some issues of legal challenges and legal issues and around medical ethics and lots of other things. So that's been enormously productive. We're going to be having 2 more of these meetings before the end of the project. It runs until the middle of, around this time next year. Or sorry, till the end of next year, I should say. We also basically volunteers from some of the stakeholder organizations attended DRI Digital Preservation for Community Archives training, which is a training program run by DRI for smaller or voluntary archives who need a bit of help managing and putting together their digital archives and preparing them for ingest into DRI. So we had representatives from some of the stakeholder organizations, and as a result, they were able to assist with the actual putting together of the collections that I showed you earlier, which was great. The training goes through collection creation, copyright and licensing, file formats, metadata, and practical ingest. Just want to talk a little bit about open scholarship before we finish up, because it's quite important to this project. We always want to, basically in DRI, we try and abide by the principles of fair data. We're signed up to various kind of covenants to that regard, and we're part of the National Open Research Forum. So the data in this these collections is, as much as is possible, fair, which means findable, accessible, interoperable, and reusable. I'm sure most of you are familiar with that. So the way in which it is fair in terms of findable, I explained a bit about the vocabularies, which are consistent across the collections and allow for cross-searching and connections. Accessible, everything is open access where possible, except for the examples where it is restricted according to our ethics protocol. And of course, the metadata is always open access. Interoperable, we use open source formats, JPEG for images, PDF and RTF for text files, MP4 for videos, and several others. Reusable. So I mentioned earlier about the rights and licenses. In our deposit agreements with the stakeholder organizations, we have committed to publishing this material under a Creative Commons open license unless otherwise stated. This allows browsers to share this material freely as long as the rights holder is credited. Some material is produced by a third party, i.e. that video I showed you earlier, that was produced by an individual, but permission was sought and granted under a Creative Commons license by contacting the individual directly, which again is a great example of the usefulness of direct collaboration with individuals and organizations. Of course, publication of research protocols, as I showed you earlier, and later on our vocabulary research, it's in the spirit of open scholarship, providing guidance and tools for other projects and users, including researchers. And of course, the training that we've been running helps the volunteers understand the principles of fair data. I won't go into too much detail about how our infrastructure actually works, but just in case anyone's interested, there's a little, it's an excerpt from our Building the Digital Repository of Ireland infrastructure. Basically, it's open source software. You see it runs on a Ruby on Rails server and use Python. And it is basically a kind of a bespoke software creation using open source. The full code is available on GitHub if anyone is interested in looking into that. But it basically ensures long-term preservation and open access and ease of access. Just going to briefly mention the National Open Research Forum, which is not directly related to this project, but is in the context of using, trying to make the collections available as fair data. It's a national, it's established in 2017 to drive the Irish agenda for open research. The role of NORF is to propose national actions to address the challenges of changing the Irish research system to promote better support open research practices. And we have the National Open Research Coordinator working in DRI at the moment, Dr. Daniel Bangert, and he works with NORF on the development of delivery of a national action plan for the implementation of open research across Ireland. And of course, our director, Natalie Harrower, is appointed to the core oversight group of the steering forum. So these kind of principles inform all work we do in DRI, and it's something that we try and keep in mind when we are debating or talking about bringing in new collections. Okay, I think I've just about gone to 40 minutes or maybe 45. So that seems like good timing just to finish up, but there's contact details at the bottom of this slide. If anyone has inquiries about In Her Shoe specifically, the Irish Qualitative Data Archive email address is the best one to contact. Otherwise, you can contact me, and that's the website there, DARIAH-EU, Archiving Reproductive Health. Thanks very much.